I get a lot of questions about doing facial rejuvenation using PDO threads or polydioxanone threads. And what those are is basically suture material that has certain barbs on it where you sort of pass it through the tissues and those barbs catch it, kind of like a stinger on a bee. That's the way it creates the lift, and it's placed through one part of the face and then it's brought out through another spot on the scalp area usually, and it's driven in a direction to give that lifting effect. You have believers in these threads and you have non-believers. I typically believe in doing a standard surgical approach to any type of facial rejuvenation. I don't think these threads are long-lasting. They are not risk-free. And so it's important to understand that although there's minimal downtime, the results can also be quite minimal. It does nothing to address skin laxity. It does nothing to address volume. Even with a droopy face that you're trying to lift up, that skin can bunch. If the thread is placed a little too superficially, you can see some dimpling. And if it's placed too deep, you can get an injury to the facial muscles or the facial nerve, which is devastating. And I see that quite a bit in my office, having a patient who's gone somewhere and done something that was quote unquote minimally invasive only to have a facial nerve injury that I now have to correct. Keep that in mind whenever you're going out there looking for a minimal option. There are no shortcuts to these things. I know the price difference sometimes is a motivating factor to go in one direction or another, but I think at the end of the day, you don't want to make a mistake. You don't want to add more scar tissue to your face that you don't need, and you don't want to put yourself at extra risk. So that's my take on it. I know a lot of people love threads out there. Tell me what you think about it. If you want a facial rejuvenation and you want a proper consult, by all means come on in. We would be happy to see you.